If you've been feeling a little more forgetful lately, misplacing things, struggling to recall names, or losing your train of thought mid-sentence, what I'm about to tell you might genuinely surprise you, because sometimes the cause isn't aging itself. It could be something sitting quietly in your medicine cabinet right now, something you trust, something you take every day. Before we go any further, take a moment to like this video and subscribe to the channel. It helps more people become aware of these hidden health risks, and it might just help someone you love. Now, I want you to imagine this. You're doing everything right. You're taking your medications as prescribed. You're trying to stay healthy. And yet, slowly, almost invisibly, your memory begins to slip. You brush it off at first. It's just stress, you tell yourself. It's just age. But over time, those small lapses begin to grow. I've seen this happen too many times. Patients come in worried, confused, sometimes even frightened. They think they're developing something serious like dementia, and in some cases, they are. But what many don't realize is that certain commonly used medications, yes, even ones prescribed by doctors, can sometimes affect how your brain functions, especially after the age of 60. Most people don't realize that as we age, our brain becomes more sensitive to chemical changes. Medications that once worked perfectly fine can start to interact differently with the body. The same dose, the same routine, but a completely different effect. And here's the part that concerns me the most. These changes often happen gradually, so slowly that you don't notice them right away. You adapt, you compensate, you forget, and then forget that you forgot. This doesn't mean medications are bad or unnecessary. Many are life-saving and essential, but awareness is everything. Knowing what to watch for, understanding the subtle signals your body sends, that can make all the difference. Because early recognition may help you and your doctor make safer, smarter decisions. And in the next few moments, I'm going to walk you through something most people never get told until it's already affecting their lives. What I'm about to share with you is something that often goes unnoticed, even by well-meaning patients who are trying to take care of their health. There's a group of medications commonly used for allergies, sleep problems, and even cold symptoms that may quietly affect how your brain processes information. Most people don't realize that certain medications have what we call anticholinergic effects. That may sound technical, but let me explain it simply. Your brain relies on a chemical messenger called acetylcholine to support memory, learning, and focus. When a medication interferes with this system, it can slow down communication between brain cells. At first, the signs can be subtle. You might feel a little more tired than usual, maybe slightly foggy. You walk into a room and forget why you went there. It happens to all of us occasionally, but when it becomes frequent, it deserves attention. I've seen patients who were taking over-the-counter allergy medications for years, completely unaware that these drugs, while helpful for sneezing or itching, could also make them feel mentally dull over time. Sleep aids can have a similar effect. They may help you fall asleep, but the next day, your mind feels heavy, slower, less sharp. And here's where it becomes more concerning. When these medications are taken regularly, especially in combination with others that have similar effects, the impact on the brain can accumulate. It's not just one pill, it's the overall load on your system. What I'm about to tell you might surprise you. Many people don't connect their memory issues to these medications at all. They assume it's just aging. But in some cases, reducing or adjusting these medications under a doctor's guidance can lead to noticeable improvement in mental clarity. That's why it's so important to regularly review everything you're taking, not just prescriptions, but also over-the-counter products. Because sometimes the smallest, most routine habits can have the biggest long-term impact. And this is just the beginning. There are other types of medications, often prescribed for completely different reasons, that may also play a role in how your brain functions as you get older. And the next one is something I see far more often than people expect. There's another category of medications that I want you to be especially aware of, because they are often prescribed with good intentions, and in many cases, they are absolutely necessary. But under certain conditions, they may also affect how clearly your brain is able to function. I'm talking about medications used to help with anxiety, sleep, and sometimes even muscle relaxation. Drugs like diazepam or alprazolam belong to a class known as benzodiazepines. Now, these medications work by calming the nervous system. They can reduce anxiety, promote sleep, and help people feel more relaxed. And for short-term use, they can be very effective. But here's what most people don't realize. As we age, our bodies process these medications more slowly. That means they can stay in your system longer than intended. Instead of just helping you sleep at night, they may still be affecting your brain the next morning, and sometimes even throughout the day. You might wake up feeling groggy. You may notice your reaction time is slower. Conversations might feel harder to follow, and in some cases, memory becomes less reliable. It's not always dramatic. In fact, it's often subtle enough to ignore at first. I've seen this happen too many times. Patients who begin to rely on these medications regularly, only to later experience increased confusion, forgetfulness, or even episodes of disorientation. They don't immediately connect the two. What's even more important to understand is that long-term use, especially in higher doses, has been linked in some studies to an increased risk of cognitive decline. That doesn't mean these medications directly cause conditions like Alzheimer's disease, but there may be an association that deserves attention and caution. This is why doctors often recommend using these medications for the shortest duration necessary and exploring safer alternatives when possible. Non-drug approaches, like improving sleep routines or managing stress naturally, can sometimes reduce the need for them. If you or someone you love has been taking these medications for a long time, don't panic. But do start asking questions. A simple medication review with your doctor can open the door to safer options. Because sometimes, protecting your brain isn't about adding more, it's about carefully reassessing what's already there. Now, there's another type of medication that many people take every single day without giving it a second thought. It's so common, so routine, that it rarely raises concern. And yet, what I'm about to tell you might surprise you. These are medications used to manage acid reflux, heartburn, and stomach ulcers. Drugs like omeprazole or pantoprazole. They belong to a group called proton pump inhibitors, often shortened to PPIs. Now, let me be very clear. These medications can be incredibly helpful. For people suffering from chronic acid reflux or gastrointestinal issues, they provide real relief and protect the stomach lining. But like many medications, long-term use may come with effects that aren't always discussed. Most people don't realize that stomach acid plays an important role in absorbing certain nutrients, especially vitamin B12 and magnesium. When acid levels are reduced over long periods, your body may not absorb these nutrients as efficiently. And here's where it becomes important for your brain. Vitamin B12 is essential for maintaining healthy nerve cells and supporting cognitive function. Low levels over time have been linked to symptoms like memory problems, confusion, and even mood changes. It doesn't happen overnight. It develops quietly, gradually, often going unnoticed until the effects become more obvious. I've seen patients who came in with persistent fatigue, brain fog, and forgetfulness. They assumed it was just part of getting older. But when we looked closer, we found something unexpected. Nutrient deficiencies linked to long-term medication use. What's important to understand is that this doesn't mean you should stop taking these medications on your own. That can actually cause more harm than good. But it does mean you should have regular check-ins with your doctor. Simple blood tests can help monitor your nutrient levels and ensure everything stays balanced. Sometimes, all it takes is a small adjustment, a supplement, or a reassessment of dosage, because your brain depends on the right nutrients to function clearly. And when something interferes with that balance, even indirectly, it can affect how you think, remember, and feel, and there's still more to uncover. Some medications used for pain relief, ones many people rely on regularly, may also have an unexpected connection to how your brain performs over time. There's another group of medications I want you to think about carefully, because they're often used to bring relief during some of life's most uncomfortable moments. Pain, injury, chronic conditions, these are real challenges, and managing them matters. But sometimes, the very medications used to ease that pain can also influence how your brain functions, especially over time. I'm referring to opioid-based pain medications, such as oxycodone or tramadol. Now, these medications can be appropriate and necessary in certain situations. They work by binding to specific receptors in the brain to reduce the perception of pain. And when used carefully, under proper medical supervision, they can improve quality of life. But here's what many people don't fully realize. These same pathways that help block pain can also affect alertness, concentration, and memory. At first, it may feel like simple drowsiness. You might feel more relaxed, a bit slower, less focused, but with ongoing use, especially at higher doses or over longer periods, some individuals begin to notice deeper cognitive changes, difficulty concentrating, slower thinking, moments of confusion. I've seen patients who struggled to follow conversations, who felt mentally disconnected, but didn't immediately associate those changes with their pain medication. They believed it was just fatigue, or stress, or aging. And while opioids are not the sole cause of cognitive decline, prolonged use has been linked in some studies to changes in brain function that may contribute to memory challenges. Again, this doesn't mean everyone will experience these effects, but it's something that deserves awareness. Another factor to consider is how these medications interact with others. When combined with sedatives or sleep aids, the effects on the brain can become even more pronounced. The system slows down further. Clarity fades more easily. What I'm about to tell you is important. Pain management should always be balanced with cognitive health. If you're relying on these medications regularly, it's worth having an open conversation with your doctor about alternatives. Physical therapy, targeted exercises, or non-opioid treatments may help reduce dependence over time. Because your comfort matters, but so does your clarity. And there's still one more category that often flies under the radar. Medications used for blood pressure and heart health, which can also have unexpected effects on how your mind feels day to day. There's one more category that often surprises people when we talk about memory and mental clarity, and that's medications used for blood pressure and heart health. These are among the most commonly prescribed drugs in the world, and for good reason. They help reduce the risk of serious conditions like heart attack and stroke. In many cases, they are absolutely essential. But what I'm about to tell you might surprise you. Some individuals taking certain blood pressure medications, particularly those that lower heart rate or affect how blood flows, may occasionally notice changes in how alert or mentally sharp they feel. Medications like metoprolol, for example, work by slowing the heart and reducing the force of contraction. This helps protect the cardiovascular system, but it can also lead to feelings of fatigue or low energy in some people. And when your body feels slower, your mind can feel slower too. You might find yourself less focused during conversations. You may struggle to stay mentally engaged throughout the day. It's not always dramatic, and it doesn't happen to everyone, but when it does, it can be frustrating and confusing. Another factor is blood pressure itself. If it drops too low, whether due to medication or dehydration, it can reduce the amount of blood reaching the brain temporarily. This may lead to lightheadedness, dizziness, or brief moments where your thinking feels unclear. I've seen patients describe it as a fog that comes and goes. They sit down, rest, and it improves, but they never quite understand why it's happening. What's important to understand is that managing blood pressure is still critical. The risks of uncontrolled hypertension are far greater. But like everything we've discussed, it's about balance and awareness. Sometimes a simple adjustment in dosage, or even switching to a different medication, can make a noticeable difference in how you feel mentally without compromising your heart health. And here's something many people overlook. Hydration, nutrition, and timing of medication can all influence how your body responds. Small changes can lead to better stability, both physically and cognitively. If you've ever felt unusually tired, mentally slow, or slightly off after starting a new heart medication, don't ignore it. It doesn't mean something is seriously wrong, but it does mean your body is trying to tell you something. And understanding those signals is one of the most powerful things you can do for your long-term brain health. Because in the end, it's not just about living longer, it's about staying clear, present, and fully yourself for as long as possible. Now, after everything we've talked about, I want you to pause for a moment and think about your daily routine. Not just your habits, but the small, consistent choices you make without even thinking. The pills you take with your morning tea, the tablet you reach for before bed, the over-the-counter remedies you trust because they've always worked. Most people don't realize that it's not just one medication that may affect the brain, it's the combination, the layering effect. One for sleep, one for allergies, one for pain, one for blood pressure. Each one doing its job, but together, sometimes placing an unexpected burden on the system. This is especially important when we talk about conditions like dementia. It doesn't usually appear suddenly. It develops over time, influenced by many factors: genetics, lifestyle, overall health, and yes, sometimes medication use. What I'm about to tell you might bring a sense of relief, because this is something you can take control of. You don't need to fear your medications. You don't need to stop anything on your own. But you do need to stay informed. You need to stay curious about what's going into your body and how it's affecting you. I've seen this happen too many times. People ignoring early signs, brushing off forgetfulness, laughing about senior moments, until one day those moments become more frequent, more disruptive, harder to ignore. But it doesn't have to reach that point. A simple medication review with your doctor or pharmacist can uncover risks you didn't know existed. Adjustments can be made. Safer alternatives can be explored. Even small changes, like reducing unnecessary medications or spacing them differently, may help support better clarity. And don't underestimate the power of lifestyle alongside this. Quality sleep, balanced nutrition, staying mentally active, regular movement. These aren't just nice to have. They play a real role in protecting your brain as you age. Because your memory, your thoughts, your sense of self, these are precious. And protecting them isn't about doing something extreme. It's about paying attention to the details most people overlook. So if something in this message resonated with you, if you've noticed small changes, or if someone you love has, don't ignore it. Start the conversation. Ask the questions. Take that first step. Because the earlier you become aware, the more choices you have. And that can make all the difference.